The UKIP
spokesperson Caroline Jones.
Cabinet Secretary, according to Cancer Research UK's position paper on the diagnostic workforce in Wales, shortages in the diagnostic workforce are in part responsible for Wales failing to achieve waiting time targets for cancer patients since 2008. Do you agree with this analysis, Cabinet Secretary, and do you have any plans to address shortages in the diagnostic workforce in the short term?
There are thank you for the question. There are a couple of points that I've mentioned. I recognise that, of course, the diagnostic workforce are hugely, but not just to cancer, but a range of other services, and making sure that people are appropriately diagnosed and put on the road to either the certainty that they don't have the potential condition, or indeed have the opportunity to start treatment at an appropriate point in time. So there's no avoiding the diagnostic workforce, and they're important to be able to achieve real and meaningful targets. I would again just point out that if we had the English target for 85 and 62 days, then we would almost certainly achieve that on a regular basis. I'm actually looking, as I've indicated in this place and in other places as well, to look again at the current targets we have on cancers, and to look in particular at whether some weights are not revealed by our current waiting times targets. If we are to move to a single cancer pathway, as I wish us to do so, that will require further investment in the diagnostic workforce, not just for cancer, but to make sure that other services are not compromised by an additional focus on delivering a single cancer pathway. So these matters are in my mind, and I expect to have more to say towards the end of this year.
Thank you for that answer, Cabinet Secretary. Staying with the Cancer Research UK report, they highlight the patchy information available on the diagnostic workforce, which is making it difficult for local health boards to make well-informed decisions about workforce planning. We know that there is a 13% vacancy rate in diagnostic radiotherapy and have now information about shortages in endoscopy. In December, there were over 2,000 patients waiting more than 14 weeks for endoscopy and a handful waiting more than 40 weeks. Cancer Research UK predict a 40% increase in demand for endoscopy in 2 years' time. What is the Welsh Government doing to improve workforce planning for diagnostic staff, and how do you plan to cut waiting times for endoscopy services in the interim?
There are a couple of different points there. The first is that, of course, we have invested more than ever before in the future education and training of the non-medical workforce, £107 million that I announced, and at a time of falling public resource, to continue to invest even more in the workforce and their future training is a significant choice to make. There is something about understanding not just about the numbers of the workforce we need, but how we wish them to work and a more effective way of working. And the staff themselves are involved in redesigning the ways of delivering care, as well as, of course, the equipment they will need and the numbers and type of staff that we will need together as well. In terms of the information on the workforce point that you mentioned, well, health boards themselves, as the employers, I would expect them to have the information. There's a challenge about them understanding their own information systems, to understand the workforce they currently have, as well as looking to plan for the future workforce. But the introduction of Health Education Improvement Wales has been deliberately designed to help improve workforce planning in a more integrated way, and to have a national view on those areas where we need to invest in more staff.
Thank you, Cabinet Secretary. One of the recommendations of the Cancer Research UK report is to explore the use of artificial intelligence for diagnostic tests. In January, the Reform Group published a report on AI in the NHS, which highlights the potential for AI to narrow gaps in health provision. Whilst the Reform report focuses on NHS England, there are lessons for us here in Wales. In addition, last week, Microsoft announced a new platform for helping healthcare providers harness the power of AI and the cloud. Cabinet Secretary, have you or your officials considered the Reform report, and are you looking at utilising artificial intelligence to assist clinicians in NHS Wales?
There are two brief points I'd make, Chloe. The first is that even without Lee Waters in the room, I recognise that artificial intelligence is absolutely part of the future's part of today, and will become more and more a planned part of the way in which we deliver health and care services. It should help us in assisting clinicians to make choices. It should make our pathways more efficient for the citizen as well. And I think it has real potential to save resources to be reinvested within the service. So there's no doubt about artificial intelligence having a larger part to play in the future of health and social care. The second point I'd make is that we are already looking at partnerships with technology firms, so on a small basis to a larger basis. In the last few months, I've announced a significant partnership with Intel, who are looking to invest and have a partnership with Wales because of the way in which we've designed our system. It's an attractive place for technology businesses to want to work with the healthcare sector. I'm sure that my officials have looked at the report you referred to in England. I won't pretend that I've read it, but I am very clear about the future role of partnerships with technology firms and the National Health Service that don't compromise our values but should help us deliver a better service now and in the future.
Plaid Cymru spokesperson Rhina Bjorwerth.